This is 60 Seconds to Good Health, brought to you by WakeMed.
Heart murmur is basically just turbulent flow across a heart valve that you can hear with a stethoscope. And it's typically confirmed with an echocardiogram or an ultrasound of your heart. Everyone is at risk for having heart murmurs, although people with cardiovascular risk factors such as diabetes, high cholesterol, hypertension, or cigarette smokers, or certain people that have heart valve disease that run in families can be at higher risk of having heart valve disorders. A murmur can be caused by either a narrowed or stenosed valve, or a leaky or a regurgitant valve. Basically, blood flow going the wrong way. There are different stages of heart valve disease. Typically, heart valve disease is graded as mild, moderate, or severe based upon echocardiogram or ultrasound measurements of how badly a valve is narrowed or how badly a valve leaks.
To learn more, visit wakemed.org.